I'm on my way to Fusion Medical Care right now because I've been feeling super lethargic and I wake up and I'm just not ready. And I heard they were doing IV infusions, actually biochemically signatured or rather formulated to your exact chemistry, I suppose. I don't know how it all works, but we're going to find out today.
Would be damaging.
Okay.
So putting it in the fluid actually and osmolality and pH, it is actually designed so that the cell is being force fed the nutrients because of osmolarity.
So you have a compound in there is like a delivery compound, like an amino acid or something like that.
Vitamins, nutrients, amino acids.
It's like when you take calcium, you also need some fat.
Right, for absorption.
Yeah.
Right. And this way the cell has no defense against the nutrients because the pH and the osmolarity that I'm infusing at is at a higher concentration than what's inside the cell. So it force feeds the cell to accept it.
Yeah, like a low pressure point.
Pressure,
Yeah.
exactly.
Okay.
Yeah, biochemical pressures is what you could call it. So that's why we have to put it in a different agent. And then I like it, and it's just gonna be that much easier to get stick. So, about how we make it through high school.
Oh yeah.
Oh yeah.
They even have really specialized needles that they use for your arm that I didn't even know was a thing. I, like so many of us, suffer from just fatigue and like not feeling right all the time, especially lately. And I've been exploring my options, and my doctor told me about IV therapy. I'm sure you're wondering, what the heck am I talking about? Basically, what goes down is they put a bunch of good stuff for your body with like delivering agents for your cells into an IV bag, and you just sit there and get an IV as if you were like at the hospital or something. I'm sure you guys have heard of like getting them for being hungover and things like that. I've definitely heard of it before this. So I'm actually going to take you behind the scenes and see what's involved, show you the process. I'm definitely squeamish about needles, so see how this goes. Okay, what is IV therapy? I'm going to let Dr. Yolo pick up from here and just kind of give you the details. This is actually me getting it done.
Okay, here we are. Let's get started.
I'm
So,
excited.
what I'm going to do first is prepare the nutrients into separate syringes so that we don't have any cross contamination of nutrients. And they're all pre-calculated to have the correct osmolarity and osmolality, and that's compared to the patient's GFR, lab results on their kidney function.
Okay.
So in order for me to do an IV, I want to be sure that my patients have good kidney function, good liver function, in order to be able to handle the amount of liquids that we're going to give them.
Exactly.
And to be able to process the nutrients.
And how long does the procedure
Total is about an hour and 15 minutes for today's infusion. Sometimes it's longer, sometimes it's shorter.
Okay.
So for example, with iron infusions for someone who has severe anemia, it could take 20 minutes, 30 minutes, but we leave them in the office for another 15 minutes to make sure they're having good reactions. Yeah. And for a larger bag, of course, we have to perfuse it slower. Also, if we're doing like a hangover IV, we do want to perfuse it a little bit slower too, so that the medication.
The hangover IV, I've heard of that.
Yes.
That's the thing you guys offer?
Yes. Absolutely.
There's a place down the road from my house, but I'd rather come here.
You would rather come here. You have a personal touch. Yes. So with each of the nutrients that we add to the bag, there's also a specific way that you do it, so that we're making sure that there's not actual biochemical activity happening in the bag before it gets into your body.
Makes sense.
So for us here at Fusion, and the way that I do IVs, we're not just doing it run of the mill. We have scientific evidence behind it. It's not just a can,
it's not one size fits all.
They're tailored and crafted for each individual.
Do patients report what is to be expected? Am I gonna feel energized? Just depends on the cocktail, right? With whatever you put.
And it depends on the patient, depends on, a lot of it really depends on patient comfort with the thought of receiving an IV.
Sure.
Sometimes people have a lot of fear over IV or any kind of needles, either pulling fluids out of them or putting fluids into them.
Sure.
So everyone has a different reaction to it. For the most part, everyone feels more relaxed because we do put some nutrients in the IV that are not medications but naturally relax the person, like magnesium. That's one of the nutrients that I like to use, and it really helps the person to relax and feel more confident.
And doesn't it do stuff with muscle? I use it to recover from the gym. Is that a thing, or is that just some?
Absolutely. We need calcium to stimulate a muscle contraction where it shortens up and you're tight, and we need magnesium to actually loosen the muscle contraction.
Yeah.
So that's why people feel a little bit more relaxed when they get magnesium in. And it's one of the nutrients that's found in a lot of leafy greens. However, if your digestion is poor, or you're over the age of 30 where your digestion starts coming down, the ability to digest nutrients and get them into the body goes down. And a lot of people consider that a part of healthy aging.
Apparently, it gives you energy. It gives you kind of like those little ingredients that you might be missing to, I don't know, elevate your day, have a better day. So we'll see, though.
Oh, yeah. Enough of this.
Yeah, I think so too. Take a deep breath in.
See, not too bad. Actually, I found out after that they have specialized needles, apparently, that are painless. I felt the tiniest pinch, but other than that, as a patient of Fusion Medical Care, I can tell you that the customer service is on point. They were funny. We were having a good time. I was comfortable. It was clean. She seemed extremely knowledgeable. I felt like safe, you know what I mean? And nowadays, you just really don't know what a doctor's office is going to do because it's American healthcare. Like, we all get the vibes. Okay, guys, I'm going to do the research for us because I know that's what you're going to do. Okay, the first article I pull up, it says, IV therapy usually takes 30 to 45 minutes, which it did. Patients often feel rejuvenated. I do, very much do. Especially when receiving vitamins B12 or C. I think I actually got both, and a bunch of nutrients and saline solution. Like, I felt really, really good. I actually went to the gym after the experience, and I noted definite increase in strength, focus, and things like that. I also actually had a slight cold at the time, and it kind of pushed that right out of me very, very quickly. So I'm grateful for that, because when I get sick, I just notice, especially lately, I just get really sick because I have a couple issues. Anyways, you're welcome. Listen, from the moment I walked into that building to the time I left, I felt really great. Everyone made me feel comfortable, a lot of smiling faces, a lot of great, interesting people. They didn't just ask surface level stuff. They asked me how I'm genuinely doing and how I could genuinely, benefit from some of the things that they offer. I definitely don't feel any sort of air of like feeling too sterile. You know what I mean when I say that, right? Like, not, it's sterile, but it's not like beating down lights and scary doctors, Overall, I'd say the experience was a solid 9 out of 10. I only give 10s to really, really special experiences. I'm hoping to have one at Fusion Medical. I have a couple things that I'm going to be doing with them, so I'll update you on that front. But overall, this was amazing. Definitely recommend this to you guys. And if you need anything, you know where to go. It's in the bio and in the description. See ya.